Okay. Good morning, everybody. I hope you're all doing well. I hope your family and you are safe, and I hope you stay safe. Let me go over a few things, and then we'll open up for questions. I wanted to bring you up to date on what we're working on. I introduced a bill it's a bipartisan bill with my legislative friends on both the Republican and the House. The Republican and Democrat side of the Senate. There's Cassidy from Republican Louisiana, Menendez, Democrat New Jersey, Collins, Republican from Maine, Cindy Hyde-Smith, Republican from Mississippi, Cory Booker from New Jersey, and myself. So we had an equal amount, and it was a balanced bill. It's called the SMART Act, and what it does, it will accomplish two main goals. It ensures that state and local governments can use their existing funding to offset revenue shortfalls. We're trying to give that relief. It provides $500 billion in new direct flexible funding for all state, local, and tribal governments, including an estimated roughly $2 billion for West Virginia. But importantly, what I did, and I had an amendment in this bill, I worked to ensure that the bill includes dedicated funding for every municipality and county, no matter how big or how small. That way, every unit of government from the state on down will have funding to respond to the crisis and make up for lost revenues. That means that our local mayors and county commissioners won't have to be waiting on the governor to make up his or her mind on how to spend it. And I think that's a great help and relief to a lot of our all of our counties and municipalities. So we're working with them every day. We know that they're concerned about this budget shortfall. It's going to harm the services that we're rendering and depending on in all of our areas across our state, along with our state government on down to our local government. So this is not political. It never has been political. The money has to be distributed, and this is how we're going to do it. So the SMART Act really breaks down fundings in the following formula. A third will be based on population size. A third is going to be based on infection rates. And another third will be based on revenue losses. So I said states will receive a minimum of $2 billion. So the smaller states like us who got 1.25 before will get at least a $2 billion. And depending on how the formula works out, could be a little bit more. As I said before, it's a bipartisan bill, and it ensures that every county municipality is going to be treated fairly and equally and receive direct funding, mandated to go directly to them within a 15-day of getting into the state. So still working out some of the particulars about that, but that's the basis of what we've worked on. Also, I've been very much involved in Mask Up West Virginia. I've done a PSA on this. I think it's very important. I'm calling on all West Virginians to mask up in public to help curb the spread. Wearing a mask doesn't mean that you're sick. It means that you're looking out for your family, friends, and neighbors and all acquaintances as you're out. So you're doing your part to stop the spread of coronavirus. And we've got to continue to use the most hygiene methods that we can to prevent the spread. I'm also continuing to shout out about more testing, more testing, more testing. We have got to have testing because we have people going back into the workforce, and everybody going back in the workforce that should have protective PPE, personal protective equipment. And that has to be done, and the state has to be involved and maybe co-op up with other states around who've been very successful. We're reaching out, seeing how New York has been able to do all the testing they're doing. I just found out New York's also testing twice a week all of their healthcare workers, basically, especially in the nursing homes, where it can really be a full-blown disaster that takes off there. So if anybody wants to know about the Mask Up, they can do by, and it's our hashtags Mask Up West Virginia flyer and post it in their business to signify their employees wear the mask. And you can find it on my website, which is www.manchin.senate.gov. As of 5 o'clock Monday evening yesterday, we have, 77,760 total cases. Positive cases were 1,502, and deaths are 68. Every person that we lose is a disaster and a tragedy, and our hearts go out to all of the families. The CARES Act grant portal came out Friday. As you know, the state launched an online portal that allows counties and municipalities to apply for some of the state's allocated CARES Act, which is the $1.25 we've been encouraging and continue to encourage the governor and his staff. And I thank him for finally putting that out on Friday. It will help an awful lot of our localities, our communities, and our counties to hopefully be able to balance their budget. And this month of June coming up is a critical time for all the budgets to be adjusted accordingly to the balanced budget amendments. There's more businesses that are going to reopen today. It announced that there will be 50% capacity by next Tuesday. Museums, visitor centers, zoos for in-state residents, the state casinos, I believe, may reopen on Friday, June the 5th. Again, precautions must be taken. They must be tested, and they should have the PPEs. So I can go over all the different things that we're working on, and there's so many of them. So, but right now we're really concerned about our state and our local and community governments and our municipalities. Homelessness we're concerned about. I read a letter calling for $1 billion in the next Senate package to address the needs of children and youth experiencing homelessness and the sex trafficking that goes on in so many areas around this country. It's increased because of COVID-19. The letter also calls for a 40% set aside for rural areas in a family stabilization fund. More than ever, with the children and everyone being sheltered in, it's more critical, the services they're going to need. Also, I'm very much concerned about the need for food, and the price of food going up the way it is. It's going to be a real tragedy on those people that are in a lower income bracket. And I've been told that people that make $40,000 or less a year are the highest unemployed people that we have. They're being the hardest hit, and we must be very conscious of this and help in every way possible. So, background on the VA's phased reopening plan. They announced a 3-phase plan for resuming regular operations at our medical centers, benefit offices, and national cemeteries in a post-COVID-19. The VA medical centers will approach each step on a case-by-case basis, dictated by local circumstances. The cemeteries, national cemeteries, will benefit administrators and Board of Veterans Appeals. They're going to use the same 3-phase approach. So the 3-phase approach is phase 1 for the localities that satisfies gating criteria, and that's to be determined. For localities with no evidence of a rebound and that satisfy the gating criteria a second time. And the phase 3 is for localities with no evidence of a rebound, and it also satisfies the gating criteria for a third time. These are some of the things that we're doing. On a national update, there are approximately 1,504,244 confirmed cases of COVID-19 in the United States and more than 90,193 related deaths to date. There's anticipation that we will hit the 100,000 total of deaths, ironically, over Memorial Day. And it's just a very sad period of time in our history. So with that, I'll open up any questions you might have and answer to the best of my ability. And I have some of my staff on with me who might be able to help in some of the areas that you're questioning about. Well, I think, we've always known that the state's revenue has been tremendously harmed. All the states have been because of the COVID-19 and the amount of revenue they have. And now with the fiscal year coming up to a close here at the end of June, those budgets will be cut back to balance the budget in a lot of services. So, yes, this will help immensely. But there still is no excuse for not dispersing part of the money that's already been received, because that was laid out way back in April, early April, and then also refined at the end of April of how the money could be dispersed into the counties and municipalities to fight COVID-19-related costs. And that's what we were hoping. PPEs are needed. They can use it for that. That's no hindrance. They don't have to wait for any further notice on that. There's so many things that can be used for children, homelessness, food, shelter, all these things that's related to COVID-19. And that's what we were hoping would be done sooner. But I'm happy it's being done now. There's a portal, and that portal base is requesting the same as what was allowed before. What we're doing is making sure the states are going to be able, and then allow the municipalities a portion of that to be used to backfill budgets. All this is important. But basically meeting human needs is the most important thing on the front end, and I never believed that you should hold up waiting for the budget backfill when there were human needs on the front end that people were facing on a daily basis. That was my difference I had, and I just was expressing that. It wasn't political, never meant to be political, but when there's people hurting and they need testing and they need food and they need shelter and homelessness, you're able to do that. You were always able to do that when we passed the $150 billion is what we argued over in March with Senator McConnell. And I know that Senator McConnell has made the statement that maybe the states and counties, I guess, and cities and municipalities should go bankrupt, declare bankruptcy. Well, I don't buy into that, and I don't think a lot of my colleagues on both sides, bipartisan, don't buy into it in the Senate. And that's what we're fighting, and that's why we have this bipartisan bill now. Yeah, here's what we have right now. If this bill doesn't, right now, we're not going to take up anything until after we come back June 1st. So this week here, I mean, we've been 3 weeks here, and Senator McConnell has not addressed any of this. He doesn't think it's needed. And I understand where they're coming from to a certain extent. They want to review what we've already done, what's worked, what hasn't worked, how much more is going to be needed before you just throw $3 trillion at something. I understand that. But we've been here 3 weeks, Mitch, and you haven't done anything. We haven't pulled a committee together. We haven't done an overview. So we're looking at this every way we possibly can. If something is not done, I can assure you by June the 1st, we will ask for immediate clarification that the states could use at least 40 to 50% of the money that they have by the first tranche that came out. We put in $150 billion, and West Virginia got 1.25. I would be happy with West Virginia, the state, the governor, and the state being able to backfill using at least up to $500 or $600 million of that, 40 to 50%. But then the others should be going out to help the cities and communities and counties. But the human need on the front end, where people were needing personal protective equipment and testing, and there's an array of things that it could have been distributed already. That's the only thing I was critical about, holding back until we saw if the state could use it before they let any money go. That was not what it was intended, and a lot of states have used a lot of their money. But we're going to, and I will say the House put $1 trillion in for this same program almost. So it's not going to go anywhere near that. We know that. We know that McConnell and them, we don't know even if the 500, but we know that we're going to dedicate a good deal of funds to the states, cities, and municipalities to backfill their budgets. Shortfalls. It's intended to go directly, okay? It's intended to. I just heard this morning that it might have to go through the state and mandate that the state gets it into their hands within 15 days. Wes, are you on?
Senator, this is Seth. I'm on. That's correct.
Seth, is that correct?
Yes. So it would go to the states, but there is a very clear mandate that it would have to be that the state, does not allocate it itself. It's according to the formula set forth by the bill, and then that is allocated to the counties within 15 days that it goes to the state.
What we're trying to eliminate is the states, the governors, Democrat, Republican governors, taking politics out of it. They cannot. This is directly to help states. So politics cannot enter into it, where someone can make a decision, well, I like this county, or I do better over here. Or this. We're just trying to eliminate, not saying that would happen, but you want to eliminate all temptation for politics to enter into this. So it has to go out on a formula basis within 15 days. But they had to use the state portal. Seth, I understand that was the best and quickest way, other than trying to get to every locale. Yeah.
Yeah, that's correct.